Okay, so your hip is going to be your most proximal joint in the lower extremity. Obviously, it's important in weight bearing. It's a ball and socket joint. We already know that. So the femoral head is the convex part, and the acetabulum is the concave part. For as mobile as it is, it's fairly stable because we have to depend on it for weight bearing. Okay, so your hip would compare to your shoulder and the upper extremity. So yes, your hip moves in 3 planes. We talked about that till we're blue in the face, right? So yes, your hip moves in 3 planes. Yes, your shoulder moves in 3 planes. But would you agree that now that we've studied range of motion of both joints, that the shoulder has actually got more mobility than the hip?
Yes.
Sure. Okay. If your hip had more mobility, you couldn't stabilize to stand up. The other distinction is going to be that the acetabulum is much deeper than the glenoid fossa. Okay, so that's one of the other distinctions. So those things alone make it more stable. Plus, we've got just more bigger muscles and a deeper capsule to really hold that into place. Okay, so here's the pelvic bone. Here's your acetabulum or your socket. Here's the head of the femur. Here's the neck of the femur. And then here's the actual femur. So here's your greater trochanter. Down here is going to be your lesser trochanter, even though it's not named here. So when they do a hip replacement, essentially what they do is they cut this off. Cut it off and throw it away. And then they insert what we call a prosthesis. So it's a metal titanium, usually ball. So this is replaced with a metal ball. So there's a little bit of a stem here, a little bit of a neck and a ball. And then there's a sort of a cone-shaped pin, if you will. Not a pin, but more like a rod or a stake that goes down into the femur to hold it in place. Okay. Typically speaking, if you're at a point where you're ready for a hip replacement, the surgery is actually less painful and a different kind of pain than your arthritis pain has been. That people actually, you know, we don't let people lay around after these. They're up out of the bed the day of or the day after surgery.
You say, I'm sorry, you say you don't want them out of the bed?
No, we want them out of the bed. They don't get to lay around. We've got to get them up. We've got to get them up. You know, the sooner we get them up and on that, the better the healing is. And the big part of the problem, once the surgery's done, the bone, you know, this is pretty stable. It's just that you have to disrupt a lot of muscle to get in there and do that. And so it's about strengthening up the muscles around the joint again to stabilize it.
Yeah. Did they have a normal life after they had the hip replacement?
Yeah, typically, you know, it depends on the age and the condition of the patient.
Right.
Typically after a hip replacement surgery, there are movement restrictions for